Thank you, Mr. Chair. So if we're going to make any progress in addressing the maternal mortality crisis, we need to first make sure that we are having healthy moms before they get pregnant, which we talked about in part with the last amendment. We need to make sure they are healthy during pregnancy, which is, as my colleagues on the other side of the aisle have said, has always been a goal of Medicaid. And we need to make sure that they stay healthy in the postpartum period. And thanks to data collected by the CDC and analyzed by the CDC, we know what the leading causes of death are by race, by zip code. We know, socioeconomic class. We know what types of death occur when in pregnancy, and we can use that to create public policies to help address it. And we've done that in part by expanding Medicaid to the first full year postpartum, because in America, 12% of the deaths occur in the first 6 days postpartum. 23% of the deaths occur in the first 42 days, the 7 to 42 days, and 30% of the deaths occur after day 43 in the full year. And most of those are cardiovascular, or accidental overdose, or substance abuse, or suicide. And we have used our Medicaid program to help address those causes by providing substance abuse treatment for women before they get pregnant, during pregnancy, and after, by making sure we connect women to medical homes so they're getting their preventative care to identify and treat cardiovascular issues early, and diabetes and high blood pressure early before they lead to maternal deaths. And the total actions of the Trump administration and this bill are making that harder to do, because in the last markup we had, even though it was a bipartisan bill that passed on a bipartisan basis, it ignored the fact that Secretary Kennedy has fired the very people who are helping track the data and provide the services to address the underlying causes of maternal mortality, that some of the funding rescissions or blocks by the administration were addressing those very programs. Now there are going to be requirements, whether it is a copay for somebody that makes $300 a week, or work reporting requirements that are going to make it harder for some people to get access to care before they get pregnant. And I think if you don't remember anything else I've said in the last 20 however many hours, this bill is not happening in a vacuum. This bill is happening as part of a broader effort to shift federal funding to tax cuts. This bill is part of a broader effort by the Trump administration and DOJ to shrink the federal government and federal spending, particularly in the health and human services space. And these are impacting people's lives, especially our mothers and our babies. And I heard on the other side of the aisle that you want to work together to fix some of these issues, but Democrats have been cut out of the process from day one. We're doing reconciliation to avoid Democrats having a seat at the table. We weren't given an opportunity to discuss any of these issues before we saw this bill. None of our amendments are being adopted. This bill will leave here and go to several other committees before it makes it to the floor. So this is our opportunity to say, please think about the holistic picture of how we help keep people in this country healthy and safe. I yield back.
Gentlelady yields back. Is there further